My name is Iman Azmi and I'm one of the consultant breast surgeons working at Chesterfield Royal Hospital. I'm also lead for breast services here. Supported self-management is the new system of follow-up for patients who've received treatment for breast cancer. And this is to replace the traditional system of follow-up, which involved patients coming up to the clinic annually for visits and for a clinical examination. What we've learnt over the years is that that's not really necessary, and it's very rare for us to pick up problems at these visits. We also recognise that a lot of these visits induce anxiety in our patients, so they can be detrimental in a way. So the new system of follow-up involves the patient keeping an eye on things for themselves with the support of the team here at Chesterfield Royal and their GP. The way that this is organised is that at the end of their treatment, they're invited back for a visit that's called an end of treatment visit. That's usually 3 or 4 months after their last treatment. This visit is conducted with one of the breast care nurses, who then goes very carefully through the treatment that that patient has received so that they understand exactly what's happened, but also what the longer term consequences of that treatment is. They're also given advice about things to look out for the future and signs that the breast cancer could have come back. And ultimately, if a patient does notice anything different or has a problem, perhaps related to medication, they can access the team directly just by calling one of the breast care nurses.
Hi, I'm Emily, one of the breast clinical nurse specialists here at Chesterfield Royal Hospital, working in the breast department. 4 months after completion of treatment, we will offer an end of treatment appointment with one of the breast care nurses. During this appointment, the CNS will discuss your diagnosis, treatment, side effects and medication that you are prescribed. We will give you advice on breast awareness and what to do in the future if you have any new concerns. We will explain the arrangements for further scans and mammographic surveillance, if appropriate. The CNS will discuss supported self-management and how to re-access the service if needed. Re-access is a new pathway for breast cancer services, allowing individuals, when they have a problem or concern, to contact the breast care nurses. Even though we won't regularly see you in clinic, they will be able to re-access the service. This means we don't need to see you when you are well. If any issues or concerns arise, you'll be able to contact the nurses and have a discussion with them over the telephone, who will then book you into the appropriate clinic. This means we can offer quicker support should you need it without having to see your GP. Annalistic needs assessment is an optional self-assessment that will be offered 2 weeks prior to your end of treatment appointment. This will be offered by the Macmillan Information and Support Centre. This will give individuals a chance to think about any concerns which they may be highlighted prior to your end of treatment appointment. This assessment is designed to help and understand and identify any concerns following completion of treatment.
Hello, I'm Maria Leadbeater and I work in the Macmillan Information Centre. You'll be invited for a holistic need assessment, which is basically a supportive conversation about any concerns that you might have at this time. For some people, this may be practical issues such as work or finances or looking after children or relatives. For other people, it may be the physical impact of everything they've been through, and for others, it can be the emotional impact that they want to talk about. The aim of the assessment is to listen and to work with you to look at any support that we can offer you. We know when people come for the assessment, they find it really beneficial, but regardless of whether you accept the invitation, do remember the Information Centre is available to you at any point in the coming months and years.
The new system of supported self-management is actually a nationwide initiative, so lots of different trusts up and down the country are moving towards the same system of follow-up. So we're not alone, and this has been really welcomed by patients and by breast cancer charities, who can see it as a very positive way for patients to monitor matters for themselves, but also free up services for the people that need them the most.